Dr. Narakar, this is going to be hard for some people to hear, but I think it's also necessary, especially for those who believe that limiting access to AR-style weapons won't stop gun violence. But clearly, Doctor, they're dangerous enough for armed police officers to take cover and call for backup instead of confronting the shooter. So for our viewers, please explain, as a physician, how much more devastating are these kinds of weapons?
So, Eric, many people say that gun violence isn't a public health issue, but I would vehemently disagree. We as doctors of all trades see gun violence and the immediate ramifications of what happens when guns are used on civilians. We see this in the ERs, in the trauma bays, and all parts of the hospital and the operating room. These weapons are incredibly dangerous and should not be in the hands of any civilian, let alone someone who is 18 years old. With this particular incident in Texas, this 18-year-old boy can't buy a beer, but he can buy a assault-style weapon. Something isn't right there. Our legal age for drinking is 21. Our legal age to purchase any firearm should also be 21, in addition to background checks and all sorts of other measures, because we know that 90% of Americans support gun reform and stricter gun measures.
And still, when this kind of thing happens, we often hear things like, it's not about access to guns and gun laws, it's a mental illness problem. We heard that from the governor of Texas. What's your reaction to that, Doctor?
It angers me, Eric, quite frankly. Mental health and mental illness are often the scapegoat, but the real issue is access to guns. We know in the medical field that mental illness is not connected to gun violence in this way. When people have a mental illness and they have an access to a gun, they're more likely to inflict self-harm rather than injure others. There's a 3 times greater suicide risk of having a weapon versus not. We also know that people with mental illness are more likely to be victims of gun violence. So this is something that needs to be decoupled. The national conversation should not be about mental illness and gun violence in this way. We need to think about gun reform and the access to guns as the main issue and the driver here.
But Dr. Narakar, gun reform and limiting access can seem impossible in this country with the Second Amendment, with the powers that be that don't want that to happen. So with that in mind, you drew an interesting comparison between the NRA and gun violence and big tobacco and heart and lung problems. Can you explain that to us here today?
Sure, Eric. So when I was talking about the real similarities, in my view, I see a great similarity historically between what has happened with big tobacco and access to cigarettes and the various regulations that we have for cigarettes and what the NRA and the gun lobby is doing now. So what I was alluding to is that guns are the cigarettes of 2022. Back in the 1980s, in my lifetime, we saw a real shift with that Surgeon General C. Everett Koop pushing for cigarettes to be a public health issue. Surgeon General warnings were put on cigarette boxes. The age was changed to be able to get cigarettes. People had to show an ID. There were many regulations because the American public pushed for it and supported it. In spite of big tobacco pushing back, we know that prior to that, decades and decades of time, the big tobacco is a very powerful industry, lots of similarities to the NRA, deep ties to the political spectrum, lots of deep pockets. So there is a lot there to really, there's a lot of similarities between the NRA and big tobacco. In my view, I think that the American people now, there's a groundswell. 90% of Americans support stricter gun rules, and we can make a difference the same way that we did with a powerful gun lobby back in the 1980s. With tobacco, we can do the same with guns today in 2022.
Yeah, Doctor, we have seen those different studies with different numbers, but at least in general, it does appear, according to a lot of surveys, that there is an overwhelming support to have some kind of reform, different ways, of course. But all of that, it seems pretty daunting for people. Even with popular supports, it feels sometimes like that's never going to happen. People are burnt out, disillusioned, feeling hopeless when this happens time and again. So as we continue to collectively process this, Doctor, what advice do you have for all of us?
We have to protect our mental health during this time. That is so critical as parents, as citizens, as people, as caregivers. We also, one idea that I've been really thinking about is this concept of flooding. It's a psychological phenomenon that we experience when it's just much too much. And I think we are seeing so many assaults on our senses over the past several weeks, and we are all experiencing individually and collectively a sense of psychological flooding when we just shut down. So we need to protect our boundaries, really focus on our sleep, our sense of social support, protecting media boundaries, and help us cope with what's going on now so we can feel a sense of strength, solidarity, and empowerment for what's ahead in the future.
Dr. Aditi Nerikar, thanks for coming on to spread that important message with us today.
Thanks, Eric, for having me.